Many thanks to our partners, Governor Whitmer and Governor Wolf, for joining the summit and sharing their insights. Michigan and Pennsylvania have shown that progress is possible in the fight against the overdose epidemic. Of course, there's still much work to be done. As you heard Mike announce, Bloomberg Philanthropies is expanding its ambitious work to 5 more states. We're excited to hear from their governors. Let's hear from them now. Here are North Carolina Governor Roy Cooper, New Mexico Governor Michelle Lujan Grisham, and Wisconsin Governor Tony Evers. So, Governor, first, what interventions are you most proud of that your state has implemented to ensure that people with opioid use disorder have access to medication treatment and harm reduction services?
Well, first, to Bloomberg, the foundation, and to you, Dr. Henning, thank you very much for including me. It's exactly these kinds of conversations that lead to stronger policy efforts state to state, and frankly, a stronger national framework. I think an area where New Mexico has been seen as a leader is really trying to get right effective treatment, including outpatient treatment for particularly significant mental health issues and diagnoses that really require not only prescription drug treatment often for success, but also having providers available. And during COVID, we really expanded what we were doing in telehealth and telemedicine. We see it as a giant step in the right direction, no matter how remotely you are living or how scarce our healthcare resources are with or without a pandemic.
We are proud of the work that we've done in North Carolina. In fact, a few years ago, we put together an opioid action plan. We were concentrating on evidence-based treatment that we know works out there. We've also focused on people who are in our prisons or otherwise in our justice system. We know when you go through a prison, a lot of people are there because of their addiction treatment. And we know that most people in prison are going to be back out in society again. So we have concentrated treatment there that also follows outside when you leave prison walls. We passed something called the STOP Act, which greatly reduced prescription opioids. And we're really proud that before the pandemic, we were really turning the corner. The number of ER visits, emergency room visits for people with overdose was declining, and the number of deaths was declining. But then the pandemic hit. And so we know we got a lot more to do.
The piece that we're most proud of is we've established a hub and spoke model. We're really excited about that. It provides a continuum of services with the hub being, if somebody needs to be have very significant services that might keep them overnight, keep them in a place for a period of time. 2, as people move out of that issue of being really severely impacted, to others to support. So I feel very proud about that.
What would you say your biggest lesson learned has been over the last 2 years in this area? What would be the thing that you'd want to make sure to mention?
Yeah, I think it's really put a light on the fact that we have to really attack the underlying disease of addiction and do everything that we can to try to remove the stigma. When someone has a heart attack or cancer, families are bringing over the meatloaf and everybody comes to the aid. When there's somebody with substance use disorder or addiction issues, people scatter. And a lot of that is because of the stigma that is out there. And we've got to realize that this is, in fact, a disease that we have to treat head on. I'd also say to everybody that everybody has a role to play. Local governments, medical providers, faith-based groups, family members, everybody has to have a role in fighting this disease of addiction that's out there.
The lesson I've learned, certainly as a governor, that this is a priority area. It saves lives. It saves whole families. It sustains relationships. Without those relationships, not triggers, but relationships, there's no such thing as long-term recovery or resiliency. My advice is this country is going to have to really treat this as the public health crisis it is. And COVID-19 has taught us there are real public health crises amongst us in a number of ways. And I don't want to trade one for another. I want to embrace that all of them can be attended to by focusing on the right stuff in the right ways.
People are more willing to talk about behavioral mental health issues than ever before. They're more willing to not hide addiction issues than ever before. People are concerned about it. And so that gives us, unfortunately, a horrible impetus to be more aggressive about it.
What about looking ahead? What do you see for the future? What are you going to be concentrating on in the next year or two, presuming this COVID pandemic will be still with us for a bit longer?
It's time for us to take advantage of a horrible situation and make sure that we have the services available for people as close to home as possible. If you think through this, as someone that's addicted in northern or northwestern Wisconsin, the idea that somehow they're going to have to travel to Milwaukee, which is like a 5-hour drive, to receive those services, that just isn't going to work. I mean, simple as that. We need an all hands on deck effort, and I think we're poised to do that here in Wisconsin.
Well, first, I want to get Medicaid expanded in my state. We've come so close a number of times, and I'm in the middle right now as we speak of a budget battle, and Medicaid expansion is part of that focus. In the future, we want to funnel our resources and do everything that we can to treat this like the disease that it is, because anybody who has had this as part of their family, we know it's hard on the person who has the substance use disorder, but family members sometimes get hit even harder because it is so difficult to deal with. We know it's a process, that addiction treatment is a process that happens over a period of time that, we want to make sure that we can provide the services that we need to help those people and to help their families as well.
For me, it's really important that we figure out sustainable housing and career education and family support mechanisms that are treatment models in their own rights. What governors need is every idea that we know transitions this country into a brand new, aggressive framework to really do the heavy lifting that's required in this moment, to make sure that we make the differences that we know that we can make if we have all of our supports and tools working together productively.
Thank you again to all the governors for taking the time and for their strong leadership in combating the overdose epidemic. We look forward to sharing some of the results of our continued partnership at next year's summit. And now I'm going to hand the program back to Josh Sharfstein for a status update on the COVID-19 pandemic. Josh?